We're here with Mavis Kelly, who is an excellent holistic health coach. Tell us a little bit about that.
Sure. A holistic health coach is someone who partners with someone who has some health conditions that may be going on. Either they're struggling with other issues in their life. It could be surrounding relationships. It could be surrounding food, nutrition, disease, just a litany of things. So I'm that person that comes in that will make a difference in your life.
That sounds good. What brings you here to Randolph's event, Taste of Health Wellness Expo?
Well, I think it's an excellent organization. Not only that, I think it's an excellent way to get out and help other people to really make a difference in someone else's life, especially when it comes to health and wellness, because with good health, life is really not worth living.
Absolutely.
So I'd like to come out and make a difference.
Absolutely.
So that's what brought me here.
Most importantly, Ms. Kelly, how can the community, how can the people reach you?
Sure. Most people reach me by through my website, which is inspirehealthyliving.com, and that's actually spelled with an N, without an I, so it's NSPIRE, healthyliving.com. Or they can reach me at Mavis, MAVIS, at inspirehealthyliving.net. So those are two ways there.
Thank you so much for coming. It's been a pleasure.
Thank you, Cindy.
We're here for you today. We have the award-winning Vanessa Bowman with The Bodyguarding, a superfood hero super guide to a super kid. Ms. Bowman, tell us a little bit about The Bodyguarding.
The Bodyguarding book came about as a foster mom for 7 years. It was very difficult to get the children to eat. So I started telling them stories about how this food does this for your body and that food does that for your body, and started thinking that maybe I should record this information and make it available to all children everywhere, because it did encourage the children to start trying to eat a little better. And that's why I started the Bodyguarding book. And I also have a 4-year-old granddaughter that inspired me to go on and stop procrastinating and go on and write the book before she grew up.
They will inspire us to make some moves, won't they? Ms. Bowman, tell us how we can purchase The Bodyguarding.
We are on Amazon. You can go to thebodyguardingbook.com and it will direct you on how to purchase the book. Thank you.
All right. DJ, capital K in the building right now with the Taste of Health Expo. Tell us what brings you here today, DJ.
I'm just happy to be a part of the event. You know, I was invited out, and once I heard about what the event was about, I was excited. You know, I'm always looking forward to anything that has to do with health, wealth, and happiness. Hopefully everybody had a good time today, shook some hands, and I look forward to doing a lot more work with this community.
Good stuff, good stuff. How can we reach you, DJ?
You can link with me at DJ capital K, DJ CAPITOL, capital K. Facebook, Instagram, Twitter, also booking DJ capital K at gmail.com. Vision Radio, VYZION, Vision Radio, Monday through Friday, 10 p.m. to midnight.
You heard it here. Thank you so much.
Thank you.
The man, the Mutima Anderson herself, the founder and executive director of Randolph. Here we are here at the Taste of Health Wellness Expo, Randolph's event. Tell us how you came up with this vision.
Well, actually, it was a group vision with my community outreach director. She actually presented the idea. We do community outreach. We try to promote and heighten diabetes awareness through education and advocacy and community outreach. And one of the main components to fighting diabetes is through nutrition. So we wanted to host a health and wellness expo to showcase the diversity of healthy eating. Because a lot of people think when you eat healthy, it has to be boring, unseasoned food. So that's how we kind of came up with the idea to host an expo to showcase the diversity of healthy eating, where you can see how food can be prepared and made delicious and it's healthy for you.
That's good stuff.
Yeah.
What are some of the main things we should watch out for as far as diabetes or symptoms, or you know how we walk around sometimes dormant, not knowing, you know, information? What are some of the things we can look out for?
Well, I think you want to always make sure you have a you know your ABCs, and that's your always know your A1C level, your blood pressure. Make sure you don't have high blood pressure, because that can put you at great risk, and your cholesterol level. There are a lot of risk factors to diabetes, especially type 2 diabetes. If you have a family history of type 2 diabetes. And also, we did a presentation earlier about the dangers of sugar. You really have to watch what you're eating. So we just ask people to try to maintain, of course, a healthy weight, be active, work out or walk. Something as simple as walking, drinking water. But if you have another risk factor is, unfortunately, is your race. African Americans are greatly, disproportionately affected by diabetes.
Wow.
So yes, now I'm not saying just because you're African American, you're going to be diabetic. But being African American, if you have a family history of diabetes, if you're overweight, those increases your risk.
Okay.
Increase your risk of having type 2 diabetes.
Now, we know with diseases, also what can come with them are myths. Are there any myths you can bust for us today about diabetes?
Yes, that cake, that you eat too much sugar. Like diabetes is this sugar thing. I mean, I like cake, I eat cake, but I don't eat cake every day. I don't eat a full-size, cake every day. So that's a myth. Sugar doesn't cause that, cause diabetes.
Sugar does not
No,
cause
you can
diabetes.
have sugar, but you have to also watch other things that you're eating. There are other foods that you eat that when it breaks down into your system, it turns into sugar. So if you're having cake, you're having corn, you're having other food starches, that can, that's not good. But another myth with diabetes is that if you, like I mentioned, if you have a family history, a lot of people assume if your mother passed away, your grandmother passed away, that because of a hereditary component that you'll get it. And that's not true. Yeah, that's a myth. That's not true.
So even if your parents, grandparents,
Yes.
you will not automatically
No, you
get
won't
it?
automatically get it. And type 2 diabetes is preventable. Type 2 diabetes is preventable. And to learn some of the preventive measures, please visit our website and we have free educational resources. We do workshops. We have a support group that's led by our community outreach director. She's really wonderful facilitating that support group. So we have all the educational tools that you need to help fight diabetes.
And again, most importantly, how did you say that we can contact?
You can contact, we have a website, it's www.fightdiabetesnow.org. That's fightdiabetesnow.org. On Facebook, Ruby A. Neeson Diabetes Awareness Foundation. Fightdiabetesnow.org, and you can link to our Twitter, Facebook, Instagram, all of that, set up by our amazing marketing director. So yeah, we just we want to decrease the rapid growth rate of diabetes. That's our mission and our vision.
Case in point, that's good stuff.
Thank you for coming. Thank you very much.